For this month's episode of Virginia Beach Frontline Firefighter, Fire Captain Mike Carter and EMS Captain Christy Booty lead us through the process of using a 12-lead EKG. Then Engine 3 Captain Josh Sinakis illustrates the advantage of using a blitz attack on a fully involved fire. Finally, Acting Battalion Chief Danny Schreiner recaps the high-rise exercise conducted at an inhabited apartment complex and the lessons learned from it. I'm Firefighter Andrew Conlon, and you're watching Virginia Beach Frontline Firefighter. Here's your host, Virginia Beach Public Information Officer, Art Kahn.
Hi, I'm Art Kahn, the Public Information Officer for the Virginia Beach Fire Department. You know, Virginia Beach Fire Rescue, along with Virginia Beach EMS, already do a great job of treating our STEMI and chest pain patients. The Medical Operations Review Board, or MORB, has taken on the initiative of reminding everyone when to obtain a 12-lead EKG, our goals, and other best practices in an effort to continually improve our patient care delivery. EMS Captain Christy Booty, along with Fire Captain Michael Carter, explain.
Performing a 12-lead EKG in the field has become our standard of care when transporting cardiac or potential cardiac patients. The 12-lead data we transmit allows the emergency room physician to alert cardiology and the cath lab team early, which ultimately saves heart muscle and increases your patient's quality of life.
The American Heart Association and our local TIMS protocols recommend that a 12-lead EKG be obtained within 10 minutes of first patient contact for patients 35 and older with chest pain or other signs and symptoms that can be directly related to a cardiac concern. Remember that a heart attack can cause vague symptoms or be masked by other complaints. The 12-lead EKG should always be obtained where the patient is located unless other factors prevent this from occurring, such as privacy.
Once the 12-lead EKG is obtained, it should always be transmitted to the hospital and eventually uploaded to the patient report. If the 12-lead shows a STEMI, it should be transmitted to the closest STEMI receiving center within 5 to 10 minutes, followed by an immediate radio report. STEMI receiving centers are Centera Lee Hospital, Virginia Beach General Hospital, Centera Norfolk General Hospital, and Chesapeake Regional Medical Center. If the 12-lead is routine and does not indicate STEMI, hospital notification and the 12-lead transmission can occur within 10 minutes.
Patients with a STEMI 12-lead should be transported from the scene within 15 minutes of the ambulance arrival. Correct lead placement, good patient positioning, and obtaining a clean 12-lead is imperative for the best interpretation and patient assessment.
Take a few extra seconds to obtain a high-quality 12-lead and don't forget to enter the patient gender and age. A tip sheet is located on the web and on the W drive for the fire department. We understand that there are many variations in patients, situations, crews, and scenarios. Let's look at 4 scenarios that show some best practices to ensure easy transitions of care and expedite the process.
When the first response and transporting units arrive together, the ambulance LifePak 15 should be applied for the first 12-lead where the patient is, preferably before removing the patient to the ambulance, unless the situation won't allow it. Other members should obtain history, check vital signs, work on egress methods, prepare the stretcher, and set up the ambulance to receive the patient. Once treatment is started and the 12-lead is obtained, the team should work together to quickly move the patient to the ambulance, transmit the 12-lead, and contact the hospital. Similar to the last scenario, when the ambulance arrives on scene first, the ambulance crew should obtain the 12-lead EKG. As other team members arrive, they should make the same preparations as demonstrated in the first scenario.
If the ambulance is BLS, no other units are responding, and the 12-lead says STEMI or the patient has chest pain that is suspected of being cardiac in nature, they should immediately advise dispatch that they require ALS. Be mindful that the closest ALS could be the emergency room, and those crews should not delay waiting for an ALS intercept.
If the BLS crew completes a 12-lead that does not state STEMI and the patient does not require ALS, they should proceed with assessing, packaging, loading, and transporting the patient. They should transmit the 12-lead to the hospital just before calling in and include the 12-lead in the patient report.
If the fire department arrives first, the 12-lead EKG will be obtained on scene. Other members should obtain history and vital signs. Egress methods should be considered to advise the responding ambulance crew of any specialty equipment needed to move the patient.
The arriving ambulance will quickly bring their LifePak 15 to the patient, and the on-scene team will work together to swap LifePak machines. Verbal turnover and packaging starts, while patient assessment and treatments continue. Other members prepare the stretcher for patient movement and set up the ambulance to receive the patient. As soon as the monitors are swapped, one provider should take the fire department's LifePak 15 monitor to the ambulance to transmit the initial 12-lead to the hospital. A radio call to the hospital should immediately follow if the 12-lead shows STEMI or shortly after if non-STEMI.
Sometimes the scene of a medical emergency may not be conducive to obtaining a 12-lead EKG. You could be in a location where there is an inadequate privacy, or perhaps the patient would be exposed to extreme cold or heat. One course of action in this scenario might be to move the patient to a more private location, or crews could set up a screen or ask others to step away. Another option could be to include feeding the leads through the shirt to avoid exposing the patient.
The crew of the first arriving units should use their best judgment to determine whether it would be faster to move the patient directly to the ambulance or work on an alternate plan.
The information illustrated in these scenarios is designed to improve our efficiency when providing pre-hospital care to a cardiac or potential cardiac patient. We understand that every situation is different. By familiarizing yourself with the best practices, you can determine what is best for your patient. Obtaining a 12-lead within 10 minutes of first patient contact and transmitting a STEMI 12-lead with a radio report within 5 minutes can alert the hospital before you start transporting. They can have the cath lab team on the way while you are en route. Early notification and ambulance on the scene in 15 minutes or less and smooth transitions of patient save time and heart muscle, which can mean the difference between full recovery and lasting heart damage.
There are a number of ways to conduct an offensive attack on a fire. One is known as a blitz attack. This is a technique for applying a large volume of water on a fully involved fire, allowing firefighters to position hand lines quickly and effectively. In this next segment, Captain Josh Zanakis with Engine Company 3A details the advantages and technique of an effective blitz attack.
How you doing today? My name is Captain Josh Zanakis with the Virginia Beach Fire Department, Engine Company 3A. Today we're down here at the Harry E. Dizell Training Center. We're going to talk about the blitz attack. The blitz attack is another option for fireground tactics. Now that more and more Virginia Beach Fire Department engines carry in excess of 750 gallons of onboard water, the blitz attack is an option that might not have been considered with our previous configuration of 500 gallons. A major benefit of the blitz attack is that you're able to place a large volume of water onto a well-involved fire in a short amount of time. This quick application of water allows for the fire to be reset so that crews can advance a hand line into the proper location and finish fire extinguishment. We utilized a ball valve attached to the deck gun so we could control the water flow from the top of the truck. This serves two purposes. One, to control the flow, and two, it allows for the blitz attack to be performed by the driver with no additional help, since he can start and shut down the flow from the top of the engine. During the time the driver is operating the deck gun, the jump seat firefighter is able to stretch a hand line to the appropriate location while the officer conducts his 360 walk around. We found that with a 3-man engine company, this was the most optimal utilization of resources for this particular tactic. We performed this drill numerous times, and as long as we kept the blitz attack to 30 seconds or less, all tasks were able to be completed simultaneously and allowed for a smooth transition to handline operations. The driver is then able to secure their water supply. During all of our trials, we never dropped below a half a tank of water. Engine 3 has 780 gallons of tank water. While conducting our drills, we were able to calculate the following. While using an 1 3/8 tip at 80 psi, we flow 8.3 gallons per second. If we keep our blitz attacks to 33 seconds or less, that still leaves you with over 500 gallons of tank water to conduct handline operations. I hope this segment provided you with another tool to put in your toolbox for future use. If you got any questions about today's blitz attack, please contact any of the members of Engine 3A shift. We'd be more than happy to assist you.
High-rise fires are one of the most dangerous fires a firefighter may face. The Virginia Beach Fire Department recently had the opportunity to conduct a high-rise exercise at an occupied apartment complex involving elements from the Norfolk Fire Department due to the site's proximity to the city line and an auto-aid intercity agreement. In this final segment, Acting Battalion Chief Danny Schreiner explains the exercise and the lessons learned from it.
Hi, I'm Acting Battalion Chief Danny Schreiner. Today we had the opportunity to do a high-rise drill at 1351 Sapphire Drive, Diamond North Apartments. What this gave us the opportunity to do was practice a high-rise exercise in an inhabited apartment building, and to fine-tune our high-rise firefighting, especially working with our mutual aid company, City Norfolk, next door Engine 16.
The scenario at Diamond North begins with a simulated kitchen fire coming from an apartment on the 4th floor. 2 role players are inside the apartment simulating a burn victim and a smoke inhalation victim who remained inside the apartment attempting to extinguish the fire. Following our high-rise procedure, the crew aboard the first arriving unit, Engine 4, abandoned their apparatus to enter the structure to verify the alarm location and gather keys from the Knox box. Engine 4 verified sprinkler activation and smoke alarms near the fire unit and designated the west side stairwell as a fire attack stairwell. Battalion 2 arrived on scene, completing a drive around 360 size up and established command on what becomes the A side of the building. No victims were spotted awaiting rescue at balconies or windows. Engine 2 arrives on scene and proceeds to the C side of the building to supply the FDC connection. The crew then enters the building and joins Engine 4's crew in the lobby. Engine 2 and Engine 4's crews proceed up to the fire attack stairwell and hook into the standpipe 1 floor below the fire floor. In this exercise, Engine 2 assumes what is normally the ladder company's role by reconning the fire floor, forcing entry into the fire apartment, and conducting a primary search. They find 2 fire victims and evacuate them out of the building to a medical area established at the AB corner of the building. Because this building is located near the Norfolk line, a city that shares an automatic aid agreement with Virginia Beach, Norfolk Engine 16 is dispatched to the scene. After reporting to command, Engine 16 is assigned to place a backup line into operation from the attack stairwell. The Norfolk crew also checks for fire extension in the 2 apartments adjacent to the fire unit. Ladder 2 is the first arriving ladder and sets up on the A side of the structure. In this exercise, the crew is tasked with positioning the platform to access the fire apartment balcony in order to provide an external or flying standpipe, a backup source of water for fire attack. Norfolk Engine 16 provided the water supply for Ladder 2. Norfolk Battalion 3 arrived on scene with Norfolk Engine 16 and was assigned as lobby control inside the main entrance. Battalion 3 made contact with building maintenance personnel, verified control of the elevators, tracked personnel entering the building, and monitored the area of rescue assistance notification system which this building contains. Ladder 1 was the second ladder truck to arrive and positioned on side C of the structure behind Engine 2. Engine 2 would provide them water if needed. In this scenario, Ladder 1 was directed to prepare to pressurize the fire attack stairwell. Ladder 1 crew checked for vertical extension to the roof and attic space. Engine 1 arrived as the 4th engine on scene and positioned on the B side of the structure. They were instructed to check the floors below the fire for smoke conditions, checking for evacuation, and helping to determine if any remaining non-ambulatory residents could be sheltered in place.
What we got of our drill today is, again, a chance to do realistic training in an actual inhabited apartment building. The drill itself went really well. I found that the communications were clear. Even with talking through our SCBA masks, the communications were coming across loud and clear. Some of the takeaways are to pay a little bit more attention to accountability. Specifically during this exercise, we did not utilize the passports at the command buggy. I knew which units were on scene, but we did not have all the passports at the command post because we really do need to know where every single person is on the fire ground at all times. So that's one thing we'll fine-tune from this exercise. And the other thing is, just in the future, we're hoping that we can get access to more apartment buildings or businesses like this that might have the interest in inviting the fire department to do drills in their environment. Gets us the opportunity to practice skills outside inside of the training center in the real environment, and it gives us a chance to deliver specific fire safety messages to the occupants of those businesses or those apartment buildings. You can contact me, Acting Battalion Chief Danny Schreiner, if you have any questions about this exercise or if you'd like help in planning a similar exercise. You can contact me at my email, which is dschrein, D-S-C-H-R-E-I-N @vbgov.com, or on my personal cell phone, 757-412-8637.
Well, that's going to do it for this month's edition of Virginia Beach Frontline Firefighter. As always, we encourage you to send in any comments or ideas you may have for future segments to Darnell Evans at the information you see on your screen. And remember to like us on Facebook, follow us on Twitter, and watch us on YouTube. For Virginia Beach Frontline Firefighter, I'm Art Kahn.